my name is Beth Crawford. I am a nursing graduate student at West Texas A&M University. I'm gonna go ahead and show you the room. All right. I'm gonna be demonstrating a head to toe assessment on a 24-year-old female that's coming in for a physical exam. Prior to this, she has completed the general survey. We've gone over her medical history, her surgical history, her allergies. She's not currently taking any medications. I've obtained vital signs. All were within normal limits, height and weight. And then we did her cranial nerve too, the optic nerve with the Selin eye chart. She is 20/20 vision bilaterally. Her speech is intact. She's alert and oriented to person, place, and time. And we're going to go ahead and begin with the head to toe assessment. So first we're going to start with the general inspection of the head. So we're going to take a look at her scalp, noting texture of the hair, making sure the skull is intact, there's no nodules or lesions. We're also going to assess the skin for moisture, dryness, and temperature as we go along. Okay, we're going to check temporal pulses bilaterally, making sure they are 2+ and normal. And then we're going to assess the palpates, the frontal sinuses, the maxillary sinuses, making sure there's no tenderness noted. We're going to go ahead and test cranial nerve number 5, the trigeminal nerve. Tell me if this is sharp or dull.
Sharp, sharp, dull, sharp, dull.
Okay, we're going to go make sure the eyes and ears are symmetrical and that the mouth and nose are midline. Okay, we're going to go ahead and palpate the temporomandibular jaw. Go ahead and open your mouth for me. And then we should be able to fit 2 to 3 fingers behind the jaw. Go ahead and close, and then move side to side. All right, beautiful. And we didn't note any difficulty or clicking with the jaw. Okay, we're going to check the arms. We're going to look for hair distribution. We're going to look at any mole, see if any moles or lesions or discoloration. We're going to check the color of the nail beds for capillary refill. Looking for clubbing of the fingers, cyanosis, that. Okay, now we're going to go ahead and move on to the eyes. We're going to look pupillary response. Okay, just look right at me. Okay, direct and consensual, and then direct and consensual. All right, and then now we're going to accommodation. So look at my pen light in the back of the wall, and pen light in the back of the wall. All right. And then as I'm looking at the eyes, we're going to assess the sclera and the conjunctiva of each eye for nodules, redness, swelling, and then making sure the conjunctiva is nice and pink and there's no yellowing of the scleral. And then we're also going to be inspecting the cornea, the iris, and the lens for the opacity. Okay, and we're going to test cranial nerve 3, 4, and 6, the ocular motor, the trochlear, and the inducens with the six fields of gaze. All right, follow my pen light. All right, beautiful. Okay, and then we're looking for nystagmus or knee jerking of the eyes. Okay, and then we're going to look at the optic disc with red reflex. And then we're going to look for any abnormalities or papilledema. Okay, and I'm going to put my hand right here, stabilization. Okay, and the other side. Beautiful. Okay, everything looks good with the eyes. We're going to move on to the ears. We're going to make sure they look symmetrical. And then we're going to palpate the auricle, the tragus, and the mastoid of the ears, making sure there's no tenderness, nodules. Then we're going to look at the inside of the ears. We're going to pull the pen up and back for this. Okay. We're inspecting the tympanic membrane and the canal. Making sure there's no sign of redness or bulging or anything of that. And then we're gonna test cranial nerve number 8, the acoustic. Repeat what I'm saying. 69.
69.
55.
55.
And we're gonna finish up with the rubber and wine test. So, and we're gonna make sure the hearing's even on both sides. So let me know if you feel this equally, okay?
Mm-hmm.
Okay. All right. And we're gonna do the Rhine test. This test, the air to bone conduction, it should be 2 to 1. Let me know when you stop feeling the vibration.
Stop.
Okay, let me know when you stop hearing the vibrations.
Stop.
Okay. All right. Okay, we're gonna move on to the nose. Okay, we're gonna make sure there's no septal deviation. It looks good. And then we're gonna look inside. We're gonna look for asymmetry, any septal deviations, and then see if there's any mucosa, see if there's any drainage or any polyps. And then we're gonna test the patency of each nerve, so take a deep breath. Okay, and then again. Beautiful. Okay, now we're gonna go and test the olfactory nerves. Close your eyes and tell me what this smells.
Like a alcohol swab.
And then this one.
Same thing.
Beautiful. Okay, we're gonna go and move on to the mouth. We're looking at the color of the lips, seeing if they're cracked, any ulcers. Go ahead and open your mouth for me. Okay. We're looking at the mucosa, making sure it's moist and pink. There's no white patches or ulcers. And then we're inspecting the gingiva for any irritation, swelling. We're looking at the interdental papilla for any abscesses. We're noticing if there's any missing teeth, if there's any discoloration of the teeth. And then go ahead and lift your tongue up for me. And looking at the vascularization under the tongue, making sure there's no issues. Okay, now we're going to test the gag reflex. The patient responds appropriately. That's cranial nerve 9, the glossopharyngeal. Okay, go ahead and stick your tongue out and say ah.
Ah.
And the uvula is midline. This tests the vagus nerve, cranial number 10. Okay, go ahead and stick it out again for me. And then move it side to side. And that's the glossal, that's cranial nerve number 12. And then number 7 is the facial, so go ahead and smile for me. And then puff out your cheeks. Beautiful. Okay, and then cranial nerve number 11 is the spinal accessory. Go ahead and shrug your shoulders for me. Beautiful. We're going to go to the neck next. So we're making sure the trachea is midline. There's no deviation. We're not noticing any accessory accessory breathing with those muscles. That would signify any respiratory distress. And then we're going to palpate the patient's thyroid. Come behind them. And then go ahead and swallow for me. Beautiful. Okay, we're going to palpate the lymph fluids. Pre-auricle, post-auricle, submandibular, submental, and cervical, supraclavicular, and then the axillary. Beautiful. We're checking for tenderness, swelling, anything that would be considered abnormal. Okay. All right, we're going to go ahead and test the muscle strength and range of motion of the neck. Go ahead and push against my hand. Beautiful. And then the other side. All right, then look down for me, and then look up for me. Beautiful. Okay. And then next we're gonna check for the carotids, 2 plus, and 2 plus, and then you wanna check them one at a time. And then up next is any carotid breweries. So we're gonna have you take a nice big deep breath in for me, let it out, and then hold it. Okay, another time, take a deep breath in. And then hold it. All right, beautiful. All right, and then go ahead and turn around for me. Okay, we're gonna do the posterior chest. We're looking to make sure the chest is rising equally and bilaterally. There's no muscle retractions and there's no distress noted. Okay, and then I'm gonna put both of my hands next to each other and have her take a nice big deep breath in. And then come back, and we're seeing that my thumbs are rising both equally. Okay, we're gonna test for any postural vertebral tenderness. Any tender?
Mm-mm.
Any tender?
Nope.
All right, beautiful. Okay, we're gonna do tactile for bifurcatus. Go ahead and say 99.
99.
Okay.
99. 99.
Okay.
99.
Beautiful. Okay, we're gonna percuss over the lungs. And then we're listening for any hyperresidence would be fluid in the lungs, and then any hyporesidence, which would be, or hyporesidence is for COPD, and then hyporesidence would be any fluid. Okay, and then we're gonna check. Okay, and we're gonna go ahead and auscultate the lung sounds. Okay. And then we didn't notice any adventitious breath sounds such as wheezing, crackles, or rhonchi. And then we're gonna measure the diameter. So we're gonna have you take a nice big deep breath in and hold it for me. And then we're just gonna go up until a point of dullness, okay? And then one more time, nice big deep breath in. Okay. All right, and then we're gonna measure that difference there. All right, you can let your breath out. You can breathe out. Right. Okay. And then we're going to listen for bronchoscopy, corticate, and trichoscopy. So we're going to listen, and then I'll tell you to say 99, okay?
Mm-hmm.
Go ahead and say.
99.
Okay, again.
99. 99. 99.
Okay, go ahead and say E.
E.
Okay, one more time.
E.
There we are. Beautiful. Okay, go ahead and turn around for me.
Clear pieces.
Yes. All right, we're gonna do breast and axillary. So for both sexes, you're gonna look at the axillary nodes and you're gonna continue down. So for the women, you're gonna do 4 positions. So it's arms to the side, arms to the hips, arms up, and then arms bent into the front. So you're gonna look at nipple characteristics, contour, color, any redness, any masses or nodules. Those can be indicating any infection or breast cancer, and then you also want to assess the breast bilaterally to see if one is different than the other. So you're going to palpate. Once you do that, you're going to do small concentric circles. So you're going to start from the clavicle to the brow line, and then the mid-sternal line to the posterior axillary line, and you'll do deep pressure, light pressure, and medium pressure, and then you'll see if there's any nodules or anything like that, and then you're going to palpate the nipple. You're going to see for opacity, drainage, or anything like that. You're going to look for rashes, different color changes, or hyperpigmentation. You're going to look for the apex of the axillum. You'll put your hand behind the pectoral muscle and then pressing your fingers towards your chest wall. You'll keep going and palpate the breast muscles, noticing any tenderness or any nodules. And you'll put your right axilla with your left hand and continue that way. And then for the male, it is important to examine the breast, to examine the areolas for any nodules, masses, and then palpate the breast tissue for any hard, irregular bumps or any ulcerations or any painless nodules that could suggest breast cancer. Okay, now that we've finished with the posterior, we're going to go ahead and do anterior chest. So we're going to inspect it. Nice and easy, or nice and symmetrical chest rise. There's no retractory muscle usage that would indicate respiratory distress. We're gonna palpate it just for any bruises, any changes, and then we're gonna check the AP diameter. Okay. And chest and knee. And then we're gonna palpate for the point of maximum intensity. Go ahead and inhale for me. Okay. Stop breathing for a second. All right, and then I can feel it, so that's good. Okay, and then we're gonna listen to the anterior lung fields. And then we're gonna listen for the resonant percussion sounds. Go ahead and listen to the breath sounds. And then we're going to go ahead and listen to the lateral breath sounds. All right, beautiful. Okay, lean slightly forward for me. There we go. We're going to go ahead and listen to heart sounds. The aortic, right second intercostal space, the pulmonic, the left second intercostal space, the tricuspid, the lower left sternal border, and the mitral at the left fifth intercostal space at the midclavicular line, and then the Erb's point. And then listening for S1 and S2 and seeing if there's any S4s or S3s or any murmurs. Flip the bellow around, listen for any murmurs. Alright, beautiful. Okay, I'm gonna have you lean back for me. Okay, and then we're gonna do the jugular pressure. Let me bring it back a little bit. There. For jugular venous pressure, turn your head slightly to the right, and then I have my centimeter ruler. Sorry. You're good. And then we're gonna look for the pulsation at the suprasternal notch and the highest notch. Okay, we're gonna put it vertically on the sternal anal, and then something flat like a piece of paper, and then put it at the meniscus and measure it straight across. All right, beautiful. Okay, we're gonna go ahead and move on to the abdomen. So we're just gonna do a general inspection of the patient's appearance, making sure there's no bruising, scars, no pulsation, looking for masses, striae, and then looking at the temperature of the skin and the color. Okay, we're gonna go ahead and auscultate in all 4 quadrants. We're gonna listen for any bruise or anything of that nature. All right, and then bowel sounds are all normal active. And we're gonna listen to the aorta and the femoral arteries for any bruise. And then no bruise noted. We're gonna go ahead and percuss the abdomen. We're listening for tympany or any dullness. And then we're gonna go ahead and measure the liver. So we're gonna start the umbilicus. We're gonna percuss superiorly until we hear dullness. And then we go from the mid-clavicular and we percuss inferior until we hear dullness. All right, beautiful. We're gonna go ahead and measure that. And then we're gonna do the spleen and we're gonna listen to for the spleen dullness. Okay, and then we're gonna start light palpitation over the entire abdomen. And then we're looking for any pain, grimacing, any signs of tenderness, as well as feeling for masses. Okay, we're gonna go on to deep palpitation. Okay, left hand under the patient's back. Okay, big deep breath in. Okay. Okay, palpating from the liver's edge. Nice and smooth. All right, you're good to take a breath, honey. Left hand again under your back, go ahead and lay down. Okay. Okay, and then now we're going to move down to the kidney. Okay, and then the right kidney. Okay, and then we're just looking for any tenderness. Okay, we're going to go ahead and move on to the lower extremities. Okay, go ahead and raise one leg at a time. Dorsal flex the foot. Okay. Okay. And then we're checking for any pain or any herniated discs. Okay. We're going to go on range of motion of the hips. Okay. Flexion, extension, abduction, abduction, internal rotation, external rotation. And the other one. So flexion, extension, abduction, abduction, internal, external rotation. Okay, we're gonna go ahead and do the same thing with the knees. Flexion, internal, external rotation. Making sure none of the joints hyperextend. Okay, we're going to go ahead and move on to the ankles. Okay, go ahead and dorsal flex your foot. Okay. Okay, we're going to test the muscle strength. So up against my hands. Okay, down like a gas pedal. Beautiful. Okay, and then while assessing the range of motion, we're assessing the peripheral vascular system. We're looking at the legs, seeing if they're the same size, if there's any venous patterns, varicose veins, noticing the skin color and skin turgor, and seeing any hair loss. Okay, we're going to go ahead and palpate the lower extremities. Popliteal, both pulses, with both hands. dorsalis pedis pulse, posterior tibial pulse. Okay, we're going to go and check the brachial. Okay, and then radial. And then they're all 2+ bilaterally. Okay, go ahead and sit up. Okay, we're going to go ahead and continue with the range of motion. Shoulders out. Abduction across. Okay. Behind your head. Okay, and then behind your back. Looking at internal and external rotation. Okay, then we're going to test range of motion at the elbows. Straight out. Okay, we're going to test muscle strength at the same time. Okay, pull my hands towards you. There you go, just like that. Alright, you can go ahead and drop those. Okay, we're going to look at the wrists. Okay, and then pronate and supinate them. Beautiful, go ahead a little faster. Beautiful. And that's testing for cerebral function with faster movement. Okay, then go ahead and do this with your hands, fingers and knuckles. There we are. Okay. And then go ahead and test your grip strength. So go ahead and grab my fingers and pull or tighten as fast as you can. Beautiful. And there we're just testing for any muscle weakness or atrophy or weaker on one side than the other. Okay, we're going to do neurosensory checks. Okay, number identification first. Hold your hand out and close your eyes and tell me what number I'm drawing.
9.
Yes, perfect. Okay, I'm going to place an object in your hand, close your eyes, and then tell me what it is.
Cotton ball.
Yes, perfect. Okay, go open your eyes. And then that's just checking the cerebral function. Okay, we're going to do point to point. So open your hands, close your eyes. Okay, I'm going to point to a finger, and then you touch it with your nose, okay? Beautiful. Okay, and then you can open your eyes. Okay, we're going to do point to point of your lower extremities. Okay. And then run your heel up and down your shin on each side, okay? So shin up and down. Okay. And then now to the other side. Beautiful. Okay, and then at the toes, we're going to do proprioception, so close your eyes. Okay. And then I'm going to move your toe. You tell me if it's up or down.
Up.
Okay.
Down.
Beautiful. Okay, you can open your eyes. Okay, we're going to go ahead and do patient reflexes. So we're going to start, so swing over. We're going to start with that tricep. Okay, just relax. Okay, brachial. Beautiful. Okay. Okay, and then the bicep. Okay, we're going to do the brachial radialis. Beautiful. And then we're going to do the patellar. Beautiful. And then the Achilles. Alright, I have you stand up. We're going to do ataxia. Close your eyes. Okay, you're good. That's the Romberg test. That's just to make sure she's not going to lose her balance. Okay, bend over and touch your toes as much as possible. Okay, you're good. Keep down. We're going to check the patient's spine, make sure it's nice and midline, no curvatures, no scoliosis. And then we're going to check the SI joints, make sure there's no tenderness. Okay, halfway up. Okay, same thing, making sure this spine is nice and straight, no tenderness. Okay, you can stand up all the way. All right, so now we're going to test the patient's gait. So start back here and then just walk straight for me. Okay, keep going. All right, beautiful. Go ahead and go back. Okay, and then on your toes, walk straight. Okay, and then on your heels. Perfect. Okay, go ahead and sit back down. You're good. Okay, and then now we're going to go over the general exam for the men and women. So for males, we would have them lay on their left side, lateral recumbent position. We're going to look at the sacral coccyx and the anal the perianal area. We're going to examine the coccyx for any lesions or any redness or anything of that So when we go in for the rectal exam, we're gonna assess for the rectal tone, we're gonna palpate any lesions or anything, and then we're gonna palpate as much as we can on the patient's right side, and then turn the patient turn patients on the patient's left side, and then we're gonna do clockwise, look for any masses, tenderness, or any irregularities. For the prostate exam, I'm gonna take my hand further clockwise to palpate the prostate glands, sweeping my finger over the prostate glands to identify the lobes and the sulcus, noting size, shape, mobility, and the consistency of the prostate. And then that way we can identify any nodules or tenderness. And then we'll examine the penis and the scrotal for any hernias. We're going to assess the skin of the penis, if they have foreskin, the foreskins, the glands, see any scars, any inflammation or drainage. And then we're going to palpate the shaft of the penis for any abnormalities, for any tenderness or anything. And then we're going to inspect the scrotum, and that includes lifting the skin up to examine the posterior surface, any lesions or scars noticed. And then examine the scrotal contours for any masses, and then you palpate each testes, and we'll also palpate the epididymis and the penile shaft to see any masses. And then for women's genitalia examination, make sure that she has emptied her bladder before we do the exam. Make sure she's draped from mid-abdomen all the way down. Have her in the lobotomy position all the way at the end of the bed. Make sure that we have the appropriate size speculum. And then we inspect the external genitalia, the perineum, the labia majora, to see if there's any discharge, lesions, or swelling. And then for the internal examination, we'll let her know we're going to insert the speculum, apply downward pressure, and then separate the labia majora. We'll insert the closed speculum laterally, and then we'll remove my fingers from the introitus, and then turn the speculum horizontal, and then continue to maintain the pressure until it's in for the full length, and then slowly expand it to the full length. And then looking at the cervix for the color, position, and the cervical os for any discharge, bleeding, masses. And for the pap smear, you will either insert the cervical broom, the cervical scraper, or the endocervical brush to collect the sample. You insert it gently into the cervical os, rotate it, and then pull it out gently. And then once you withdraw the speculum, you slowly pull it out, while also examining the vaginal walls for any masses, lesions, any discharge bleeding that could happen. And then as the speculum is clearing the circus, start closing the speculum but maintaining your thumb on the thumb screw until it is fully out. And then you'll obtain consent while doing the pap smear to do a rectal exam, since she's in the lithotomy position. Same steps as the male rectal exam. And then in this position, you're actually able to do a bimanual examination to inspect more of to see if they have a higher up pelvic mass or higher up in the rectum. So to summarize my signings, the patient is average height and weight. She's animated, responsive to questions. She's alert and cooperative. Her thought process is coherent. Her judgment and insight is correct. She's oriented ×4. She lies flat without discomfort. Her capillary fill is less than 3 seconds. Palms are warm and dry with good color. Her nails are without clubbing or cyanosis. Hair is well groomed of average texture. Normal cephalic head, no scalp lesions. Vision was 20/20 bilateral. The conjunctiva was pink. The sclera was white. Pupils were full millimeters, constricted to 2, equally reactive to light, able to constrict. The ears were pearly gray and translucent for the tympanic membrane. The cone of light was measured at 5 in the right ear, and the left ear was clear, and the tympanic membrane was pearly gray and translucent, and it was a cone of 7. The Weber was midline, and the air conduction was proper by midline. The septum is midline, no tenderness noted. The oral mucosa was pink. The tonsils were there. There was no exudate, no spreadness. The thyroid was non-palpable. No CVA tenderness was noticed. No cervical or axillary lymph nodes noted. The lungs were resonant for percussion. The lungs were clear and equal bilaterally through auscultation. The carotid upstrokes were brisk without bruise. The angle impulse was discrete. There was good S1 and S2, no murmurs. The abdomen is concave, no scars. Color was good. Bowel signs were normal, active with all quadrants. The liver span was 7 centimeters of right clavicular line. The spleen was non-palpable. The extremities are warm without edema. No edema noted in the ankles. No varicose veins noticed. The pulses were 2+ and equal. No joint deformities, no swelling. On inspection or with examination, good range of motion in the spine, elbows, wrist, hands, ankles. All cranial nerves are intact. Good muscle tone. Strength is equal bilaterally in the neck, biceps, triceps, hand grips, and tibialis anterior. The rapid movement and the point-to-point movement was intact. Her gait is intact. Sensory vibration, stenosis is intact. The reflexes were 2+ in the biceps, triceps, brachioradialis, the Achilles, and the popliteal. That is the end of my assessment for today. Thank you.